Thank you very much. Thanks very much for the invitation, and it's an honour to speak with you. Just to say before I start that I absolutely love the Netherlands. I was here in the summer on a cycle tour. Really pleased to be back. And but I'm afraid, like many of my compatriots from the UK and Scotland, I'm sorry for not speaking any Dutch. Maybe one day that will change. Okay, so I'd like to speak to you about non-regular treatment methods and ethics. And just to begin, very briefly, my work with CAM ethics. So but please don't try to read the small print there, just to give you a general idea. I've published a number of articles over the years, for example, in the journal Bioethics, dealing specifically with complementary and alternative medicine, or just alt-med, or fringe medicine, or woo-woo, I would prefer, but they don't let you write that in academic journals. So I have, as you would see from those two papers, for example, tended to focus in on homeopathy, and I was really pleased to hear Dan in the first talk talking about homeopathy and saying the things that I'm sure everyone here already probably knows about homeopathy. It's absolutely ridiculous. So I'll say a few things about homeopathy, but I know that everybody knows what it is and just how problematic it is. I've also looked, always from the ethical side, at some other forms of fringe medicine, such as stem cell clinics in the UK, and goodness me, what they're offering, you wouldn't class it as as alternative medicine, but it certainly is on the fringe, and it's very worrying and potentially very damaging to patients. Okay. And also recently I've looked at, I would call them holistic fertility clinics. Do you know what I mean? To use a loose term. So, for example, as in this paper, acupuncture clinics that will take couples. They usually focus on women, but sometimes on men as well, because, of course, acupuncture, as we all know, has a wonderful range of effects. It's one of these wonder modalities like homeopathy and so many other forms of alt-med. It can cure just about anything. So if you are struggling with infertility, it doesn't matter if you're female, it can boost ovulation, it can boost egg counts. If you're male, it can boost sperm counts, of course. It's wonderful. And I'll talk a little bit about my research on that very, very briefly, just to illustrate something a bit later on. And that's my book that Dan had kindly mentioned as well, with my colleague Edzard Ernst, who you're probably very familiar with as well. So Edzard did the kind of physician kind of side, and I did the ethics side, because it is a book about the ethics of alt-med. And then we kind of argued over who would do things like the statistics and so on. I'll not tell you who won that argument, or whether one of us actually wanted to do it rather than not do it. Anyway, good medical ethics. There are several ingredients to good medical ethics, as I'm sure very many of you will already be aware. And if you are aware, you'll recognize this little non-exhaustive list of some of the ingredients of ethical medical practice. And of course, ethics in medicine does not just stop at the bedside in terms of practice, but it also expands to what governments and private organizations do in terms of how much they may choose to sponsor or permit forms of alt-med being delivered to the public. Of course, I don't have time to speak about many of these things today, so I'm going to focus in on just two of them: informed consent and avoidance of harm. So starting with the informed consent aspect, if you look at this from a deeper ethical perspective, informed consent is ultimately all about autonomy, giving the patient autonomy. And autonomy, and hence informed consent, are of course seen as absolute cornerstones of good medical ethics practice. Thankfully, long gone are the days of physicians basically knowing what's best for the patient and just telling the patient what to do and what to take. Now we expect, and have done of course for many decades, that patients must agree to a course of treatment. They must not just give their consent, however, it must be truly informed. And I just want to consider for a moment what that term informed entails. It entails giving the patient some form of explanation, some form of understanding about the treatment that you're proposing to give to them. And deeper down beneath that understanding, there must be some notion of a plausible scientific mechanism behind the modality that you're about to offer. Now, of course, to a general patient, it would not be necessary. In fact, it would just be confusing to mention details of scientific mechanisms, but they must be there. There must be something plausible behind a proffered understanding that is part of the information, the informed part of consent that you are offering to the patient in order to rightfully obtain their consent. Well, how does alt-med, how does woo-woo stack up to that understanding with the underlying mechanism? I don't need to dwell on this with yourselves because you'll already know, and already Dan has talked about acupuncture. In fact, you've used the same photo as me, I notice. And suffice it to say that as Dan was talking about things like chi and meridians and channels in the body, which, of course, despite decades, no centuries of research in physiology and anatomy, have never been discovered. They simply don't exist. And of course, nor should we be misled with more modern versions of a supposed mechanistic explanation of acupuncture. I'm sure you'll be pretty much familiar with how acupuncture is able to alter our neurophysiology, alter our endocrine status. Oh, that makes it very good for boosting fertility, by the way. Oh, and of course, boosts our immune system. Now, all of that might sound nice and sciencey to the layperson, but we know that it's all vague and implausible for sure. I'm just going to give another couple of examples, and I don't think I need to dwell on the details. I'm sure you pretty much, most people will know this. The good old vertebral subluxation complex that we chiropractors like to imagine is behind their modality, whereby simply correct the subluxation issue and voila, you're able to cure, again, a bewildering range of medical complaints, including, by the way, infertility. I don't actually know about in the Netherlands. I'd love to chat with colleagues later on about this, but in the UK, there has been some regulation applied to chiropractors, and they basically have been told to only try to correct sore backs, chronic lower back pain, and they're not supposed to do anything else. They're not supposed to say that their modality can treat asthma or cancer or infertility. Whether they stick to that is a bit of an open question. One of my students did a bit of research into that, and hey, guess what? Discovered that they were dispensing anti-vax advice to patients. And these are registered chiropractors that have some legal status in the UK. So the vertebral subluxation complex has been debunked. Homeopathy, I'm not really going to say much about that. Dan did a great job there. We all know that it is just nonsense. It's absolutely ludicrous. So behind all these things, and alt-meds in general, it almost defines them, does it not? We have a lack of a mechanistic basis. They are deeply implausible, in other words. So this is a problem for your proponent or practitioner of any form of alt-med. If they will listen to you, if they will engage in an honest way, in good faith, and you have an argument with them, it's great because you have the facts on your side and you should prevail. You will win. However, here's what generally happens, and you might have experienced this. They take out their get out of jail for free card. And their get out of jail for free card is what? Do you know? I'm sure you will when I tell you. It is the good old placebo effect. So if you convince such an individual or back them into a corner whereby they have to kind of admit, well, there's nothing really in the modality, quite literally in the case of homeopathy, there is nothing there, and notions of water having a memory are just fantastical, they will often say, well, you see, it works through a placebo effect. Actually, what we're doing to the patient is kind of convincing them, tricking their brain, what have you, into healing. They like to use the word healing, of course. Okay, so on the face of it, it's a pretty strong argument. And I don't know about you, but when I speak to people who are kind of neither proponents of alt-med or particularly skeptical about it, they themselves will often say, I think it works through the placebo effect, and kind of saying it in quite a favorable way. Now, I think that ethically this is highly problematic, so I want to dwell on the placebo effect a little bit as proposed by some alt-med practitioners as a get out of jail free card, because I think that it is involving deception. Okay, so we say you are actually just practicing placebo medicine, so you've got to deceive the patient into believing that they're actually receiving something that has a biological effect. It's deception. So a simple argument, and an argument that held pretty true for quite a long time in the history of the battle between science and alt-med. However, along came open-label placebos, and some of you, maybe many of you in this room, may well be familiar with Ted Kapchuk, this chap pictured here, who kind of really brought to prominence the notion of open-label placebos. So if you will, let me just tell you a little narrative about Kapchuk's research. So Kapchuk himself is a Harvard academic, and that sounds good. He's not a physician, though, nor is he a scientist, but he does have the letters MD after his name. He likes to put them up there. And that's because he's got a degree in traditional Chinese medicine, obtained many years ago from a college in China. Okay? And if you look into his background, he was, for a time, the owner of a clinic that sold herbal medicine and provided acupuncture. So that's kind of his background, and I think it says a lot in itself. But I'm not going to claim that he's a fraud or a charlatan. I don't need to do that. Let's take what he has said, what he has claimed in an academic context at face value. So, in 2010, he published a paper in a proper scientific academic journal, PLOS One, that really hit the headlines, and it quite literally did. You might be familiar with this actually appearing in the media back in 2010, and it really did strike a chord with many. I mean, I just checked for this talk, and on the formal database that I looked at, it's sitting at over 600 citations. So it has drawn a lot of academic interest as well as media interest. Note that in this research, he was funded by the NCAM organization. I don't know if you recognize this organization. So just briefly, an American organization that has been around for a number of decades. It has extracted several $1 billion from the American taxpayer. On the face of it, it has quite a good remit because it was set up to test in a scientific way using RCTs the veracity of various alternative medicines. Well, I think it was valid a number of decades ago, but having spent billions of dollars in trying to see whether any alternative medicines actually work, and finding that absolutely none of them do when subject to scientific randomized controlled trials, one would have thought, well, maybe just call it a day. But no, it lived on. It funded this study. It has, by the way, changed its name since this study was published, with the alternative being replaced by integrative. I'm sure many of you recognize this very common move where, for example, close to home, we had the Glasgow Homeopathic Hospital. There was an outcry for years by skeptics, and then just suddenly it disappeared. Well, it didn't really, because it became the Glasgow Centre for Integrative Care, because integrative is a nice word rather than alternative nowadays. Anyway, it's always interesting to know the funding sources at not. So just to mention that there. Now, very briefly, what Kapchuk and co did was they gave a number of patients a placebo medicine. Essentially, they had about 80 participants with irritable bowel syndrome, and they divided them into two groups in a classic RCT setup. One group was the experimental group or the test group, but interestingly, they got the placebo, the sugar pill. The other group of about 40 simply received no treatment at all. Okay, there was a short duration. It was 3 weeks, and the participants were asked, in the placebo group, were asked to take a sugar pill twice a day. And hey-ho, afterwards, turned out that they reported that their IBS symptoms had declined more than the no treatment group. Ah, right. I don't know if you find that particularly amazing or not, but the media certainly did. And of course, Kapchuk and very many proponents of fringe medicine were very quick to claim, and continue to claim to this day, that placebos work without deception. That's right. You can actually tell your patient, here is a sugar pill, I'm going to treat your whatever, IBS, I don't know, chronic lower back pain, cancer, asthma, infertility. I don't know where it stops necessarily, but here is an important principle. We don't even need to deceive patients. So you see what I mean? The old charge of deception against quacks who use placebo-based medicine no longer seems to stand. But I just want to look at this in a little bit more detail. Firstly, how Kapchuk recruited the participants. There's a quote there from this actual paper. They put out newspaper adverts trying to recruit participants for what they described as a novel mind-body management study of irritable bowel syndrome. So that instantly selects for individuals who have a kind of interest in that. Raise your hand if you personally would be interested in that study, in participating. Absolutely nobody, for the record, is raising their hands. Of course not, but think about your average person in the street. Well, they might just not know much about it and it sounds good, or they might actually, to some extent, be in favor of alt-med. And they sign up, and that's skewing your sample. And then the potential participants were subject to phone screening. So they were further screened, and basically you were further selecting for individuals that were probably very amenable, suggestible, you could say, to a placebo effect. What were the participants then told formally within the study before it started? They were told the following in a medical consultation setting. So this is a quote. So placebos, so for us that's a scare word, of course, have been shown in clinical studies to produce significant improvement, oh, that's positive, in mind-body self-healing processes. That's positive as well, isn't it? Think about your average person. Try to see it through their lens, not through your medical and scientific lens. I think many people are going to think, oh, well, that sounds good, mind-body self-healing processes. In the same paper, Kapchuk said that although they told them can work even when known to be inert, so that sounds as if you're telling your participants, oh, there's nothing in there, it's just a sugar pill, but then in the same sentence goes on to say, automatically triggers the body's natural healing response. Well, what's your average person going to think about that? I suggest that they're going to think, essentially that the medic is saying to them, we're going to give you something that's been shown to work. We're going to give you a pill that's been shown to work. I would conclude, therefore, that this is still a form of deception, even though the media didn't see this, and even though this was and continues to be held up as a kind of evidence to somehow support the supposedly ethical use, the non-deceptive use of all forms of fringe medicine, essentially. Kapchuk has continued to this day with his research. It never seems to be dealing with anything really sinister, where clearly a placebo effect would be of irrelevance. But he's looked at other studies with IBS, studies as well on chronic pain, like chronic low back pain, and essentially the papers, the studies all follow the same format, and they always say things that I just showed you there about how super duper these inert pills are. Okay. I think this is just still deception, I would contend. Still deception. Well, perhaps one could support that ethically by saying it's in the patient's best interests, even if you admit you're deceiving them. Well, this is certainly what we would call nowadays medical paternalism, and is generally something that most ethicists are completely against. Some ethicists will permit, they argue for, some limited use of paternalism in medicine, but even there, only in very restricted situations, only where there are very strong arguments that you should use a paternalistic approach rather than allow the patient's autonomy to be given essentially maximum consideration. So is there a special case to be made for ethically allowing placebos to be used? Well, of course, overall, the effectiveness of placebos has been studied widely. For example, in this, as it happens, also 2010, Cochrane systematic review that gathered together results from many papers. And here is a crucial line from the conclusion of the researchers of this big study. We did not find that placebo interventions have important clinical effects in general. So, that really is not a very positive account for placebos. If you look at the kind of research that has been done into placebos, not just the Kapchuk work, but others, likes of the work that has been summarized in that systematic review, here is the reality in short. Of course, the placebo effect is real. If it wasn't real, we wouldn't be having to control for it in your randomized, controlled clinical trial, where we are looking for effects that are greater than placebo. That is the very basis of medical research with patients using clinical trials, something that's better than placebo. Okay, so placebo effects tend to be unreliable, they're very difficult to repeat, and they tend to vary greatly between individuals. And as I said earlier, arguably the individuals in Kapchuk's experiments have all already been pre-selected to be very amenable to a placebo effect. Placebo effects tend to be very transient, but hey, that suits the practitioners and the clinic owners who are promoting whatever it is, homeopathy, acupuncture, and so on, because, of course, the patient will always come back for more because they'll find their treatment to be very short-lived in effect. And finally, placebos are very limited in magnitude and scope. The limited scope, of course, comes from the fact that they cannot treat profound organic illnesses, such as malignant tumors, for example. But the magnitude is also an issue for any condition treated. And the effectiveness of placebos, putting aside the transient nature and the fact they don't work at all in many individuals, the limited nature here in terms of magnitude is that generally compared to bona fide science-based treatments, they only have a small beneficial effect. And I'm trying to do placebo approaches justice here. I'm not just saying, oh, they don't work, full stop. But essentially, they work very, very minimally, I think, is the only valid scientific conclusion here. Okay, but what about the actual modalities themselves anyway? Are they willing to follow Kapchuk and actually tell the patients that we're just going to treat you with a placebo? Are they even willing to tell themselves that that is the only possible way that their modalities could have any beneficial effects? I suggest not. Why else would we be having years-long courses and degrees in forms of alternative medicine for which there is no scientific basis? Are the students being told week after week, year after year, what you're actually doing is a placebo-based medicine? It just doesn't stack up. You know, all these modalities like wet cupping, do the practitioners really think that actually this is just about a placebo effect? In other words, they are, if they do think that, going to a very elaborate form of deception on the patient. And I mean, dogs getting acupuncture. Dan, you showed an animal as well getting, it was magnetic therapy, wasn't it? Well, I don't know about in the Netherlands, and I'd love to chat to people later about it, but in the UK, alt-med for dogs is very, and pet animals in general is very popular. And it's very popular with some vets who we might classify as unethical vets, but sadly there seems to be rather many of them who want to get a buck by offering things like acupuncture to animals. I don't know what they think. If they think that their modality works just as placebo, well, dogs, how can they be suggested to them in a medical consultation that they might get better? It just is crazy. Okie dokie. So I think deception is alive and well. Even the likes of Kapchuk's supposed attempts to tell the patient that we're using a placebo are just a form of deception also. So this was under the heading of informed consent, and I suggest in conclusion that whichever way you look at it, whether you claim to be doing something real but you're not, or whether you actually say that you are performing a placebo-based therapy, you are taking away that informed element of the informed consent that is an absolute ethical cornerstone of modern and medical practice. Okie dokie, the second ethical ingredient that I want to look at is harm. And clearly harm is a bad thing, is it not? I mean, that kind of goes without saying. But the good news about alternative medicine, as anyone will tell you, is that it is gentle and natural and doesn't have side effects. And that's lovely, isn't it? Super duper. And that, of course, is to be contrasted with nasty allopathic medicine, mainstream science-based medicine, which, of course, is funded by big pharma and really overall just does us harm if only we were enlightened enough to realize it. And alt-med doesn't do any harm. Of course, it's preposterous, and I very much expect that this audience is well aware of some of the positive forms of harm that alt-med can indeed do. So pneumothorax through the maladministration of acupuncture needles, a very dangerous side effect. Similarly with cardiac tamponade, where the needle has penetrated the wall of the heart, the pericardium, and we get swelling. And I mean, the pneumothorax and tamponade are, of course, life-threatening conditions. And these are academic papers I'm showing you, and we can find case studies and case series in the academic literature of such iatrogenic damage. Chiropractic. So many, I don't know about the Netherlands again, but in the UK, so many people like to go to a chiropractor or go and try because their aunties told them it's great, this kind of thing. Very popular amongst people who go to gyms regularly. And of course, the UK government has given a little stamp of approval by regulating the profession. Good regulation, but then, the stamp of approval is problematic. Anyway, I would never go to a chiropractic. I'm horrified when people do, because I've read reports like this in the academic literature. Paraplegia following a cervical manipulation gone wrong. Quadriplegia following similar misadventures. And we can look at case studies, not just in the medical literature, but in the media, where, for example, this girl, Caitlin, so that's just 2022, an example of an individual. She went to her chiropractor for routine care, because chiropractors don't like to just cure you of something. They encourage you to come for regular adjustments to maintain your health. She went out quadriplegic. Now, of course, what will the woo-woo merchants want to tell us when we present them with these facts? They'll immediately say, firstly, it's rare. These things are very rare. You've picked them out amongst like millions of safe consultations. Well, one thing to respond to that is who knows, because records are not kept systematically in these modalities in general. The second thing they'll say is that mainstream medicine is worse. They'll say, oh, think of the terrible side effects from various forms of mainstream medicine and surgery. And they're right, of course. Terrible side effects can accrue from regular medicine. But they're forgetting a crucial aspect of medicine, and that is the risk-benefit profile. I'm sure everyone here is aware of this notion. So in mainstream medicine, yes, definitely some risks, sometimes some very substantive risks. But we only go ahead and recommend the treatment if the benefits outweigh the risks. Whereas, think about alt-med. It's not true, firstly, to say there's no risks. There certainly are risks. But even if we accept the rarity that is claimed by the proponents, look at that level of risk. It is there. We don't know the level of it. I wouldn't want to overplay it, but it's real. And it's set against utterly minimal and in very many cases absolutely zero benefits. And therefore, the risk-benefit profile is completely negative when it comes to forms of alternative medicine. Another major harm from alternative medicine is deflection from effective treatment. When we looked at the infertility clinics, we studied them on the internet, and the red bottom line there shows in summary what we found. They were not being honest with their patients. They weren't telling them the truth about the limitations of acupuncture, nor, by the way, the dangers. What did this do? Well, it infringed on their autonomy. That's the first ethical topic I was mentioning. It also provided them with false hope. But perhaps of most important concern, as time was going on, these patients, as the biological clock ticked, and they wasted more and more, not just of their money, but time in pursuing acupuncture, which cannot possibly improve fertility, they're simply going to become less and less likely to be able to have a child. Now, that was the little study that I did, and that was in the context of infertility, but it's exactly the same when it comes to actual disease. The longer the disease is untreated, because somebody's pursuing alt-med, obviously the worse it's going to get. And I'm aware from your standing there that I should probably wrap up. Just say a couple more things, if I may. Do I have a couple more minutes? Or a few minutes, okay. This thing doesn't like going back, just forward. Okay, a study there, a very large-scale observational study looking at basically separating out individuals with cancer, with curable cancers, note, and dividing them into two groups, those that had tried complementary medicines and those that had not tried complementary medicines. Guess what? Those that had tried complementary medicines were twice as likely to die from curable cancers. And then, of course, children. Now, children have got to have us as proxy in terms of their consent. And sadly, there are many stories in the media, I'm sure you'll be familiar with some of these, where deluded parents tragically have denied their children receiving regular medical attention and have died as a consequence. Okay. The little thing there about bioethics, but I'm going to go quickly because I'm aware that I'm overrunning with time, was just that I did a special issue along with Edward Ernst and another few skeptical scientists, and in the journal Bioethics, we asked for contributions on the ethics of alternative medicine. And we wanted to see what the alt-med practitioners and proponents would come up with. We thought we'd be overwhelmed with papers. We were not. There was virtual silence from the alt-med fraternity. And the papers they did submit were almost all of the same type. It works, it works. They wanted to tell us that the science showed that, oh, actually, homeopathy does work. If only you were to not be so closed-minded as to look at how water retains a memory. Ridiculous. We rejected these papers, and the alt-med proponents put up a big fuss, but we just stuck to our guns. We weren't going to allow non-science to be published. So it seems that alt-med proponents themselves are unable to defend on an ethical basis their modalities. In other words, what they are offering and supporting is simply ethically indefensible. So very briefly, my conclusions. No informed consent in alternative medicine. Harm is something that is a major problem in alternative medicine. I've not touched on, I would never have had time to touch on the various other aspects whereby alternative medicine is deeply unethical. Perhaps read my book if you want to read more about that. Finally, just leave it as an open question. Are the proponents and practitioners of alt-med, are they delusional or are they unethical? Probably a mixture of both. Actually, even those who are simply delusional, as a final comment, I would say are also unethical, because surely anybody who sets themselves up as a healthcare practitioner, whether that is somebody who is also a bona fide practitioner or somebody who's purely in the world of alt-med, does the onus not reside with them ethically for them to ensure that they are fully cognizant of the science behind their modality? To fail to do that simply through delusion is itself deeply unethical. So thank you very much for bearing me out.
Thank you very much for this nice talk. Also, very much like the criticism on open label placebos, because I always wondered what that was about. So on that paper you showed of the open label placebos, you have the second to last author, Irving Kirsch. He's quite well known for his criticism of SSRIs, where he argues that actually SSRIs are kind of closed label placebos, in the sense they don't work that much more than placebos, at least according to him. This is a matter of debate. And he kind of argues that placebos work well in depression, that's his argument, and SSRIs don't work that much better, and therefore you should be doing these open label placebos instead. I'm wondering what your thoughts are on this. I can imagine some of them, but...
Firstly, I have to say that I'm no authority on SSRIs, but I do know where you're coming from. And I'm just cautious about why any bona fide medical professional would be recommending that we simply treat patients with placebos. Firstly, as I said, I don't think we can do it without deceiving them, whatever Kapchuk and Co. Says. But surely we should be honest with our patients. I'm not saying that SSRIs don't work. I don't buy that. I've looked a little bit at the clinical results. My understanding is that overblown claims have been made about their effectiveness, but nevertheless they do work, particularly with patients that are quite severely affected with depression. That's my understanding anyway, but I'm no expert whatsoever in this. But let's say that we have a medical condition. I mean, I'll give you an example that's a bit more benign than clinical depression. Chronic low back pain, yeah, which is something that woo-woo proponents are always trying to treat because it's quite subjective, and it's pain, and we know that pain can be influenced by consultations, by theatre, probably by a reduction in stress. And a lot of proponents of alternative approaches to chronic lower back pain will kind of say, well, actually what we're doing is reducing stress. It's a kind of placebo effect. Well, we're reducing stress. Well, I would say to that, well, if that's true, why not actually be honest with the patient? Ethically, honesty is essential. You can't really have autonomy, this cornerstone of ethical medical practice, without honesty. So why not be honest? And if it is the case that no good pharmaceutical or surgical intervention exists, tell the patient. Now that is simply honest. But it is not necessarily a counsel for despair, because if it is the case that relaxation is the only thing that can help, and in some conditions that's probably going to be the case, well, surely we should be prescribing the best methods of relaxation. I don't think that for the average person, having somebody act like some form of magician and pretend to cast a spell on them is the best way to achieve relaxation. Presumably, we should be recommending, I don't know, walks in the country, time off work, whatever it takes, and that would be honest and just as efficacious if it is indeed the case that the only thing that works for chronic low back pain or perhaps some forms of depression, but I'm not really sure about that. But if it is the case, we have to be honest, is my view.
A short question and a short answer.
Okay, yeah. Sorry for the long answer.
No. Well, yes, no.
Yeah, no, I
No, yes.
One more question?
Yes.
I think you really good showed that evidence-based medicine is not the good base of medicine. It should be science-based.
I agree.
Yeah.
I agree 100%. I think plausibility and scientific basis should come first. Otherwise, we could be in the situation of trying to test out, as NCAM has been doing for decades, any old claim. We should say, first of all, wait a minute, what's the mechanism there? Where's the plausibility? And if it's not plausible, we're not going to put it to the test, because if we do, we'll just get statistical noise, which will give us random positive results.
I think that's a good one also to move over to the whole group, because
okay, yeah,
I think that not